Every time a patient sees a doctor, that visit has to be translated into standardized codes: ICD-10 for diagnoses, CPT for procedures, or CPCS for supplies and services. Those codes decide how much the hospital actually gets paid, and the margin for error is thin. Undercode a complex visit, and the organization loses money it earned. Overcode it and you risk audits, penalties, even fraud allegations. Claim denials alone cost the average hospital $4.9 million a year in rework and lost revenue. Meanwhile, there's a real shortage of qualified medical coders, and ICD-10 has more than 72,000 diagnosis codes to keep track of, with new updates and payer rules every year. That's the problem AI is being brought in to solve. AI coding tools use natural language processing to read clinical documentation, things like physician notes, operative reports, and discharge summaries, and turn them into code suggestions. The process runs in 4 steps. First, the AI analyzes the document and pulls out relevant diagnoses, procedures, and conditions. Second, it suggests ICD-10, CPT, and HCPCS codes, each with a confidence score. Third, a certified human coder reviews those suggestions, accepts or corrects them, and handles anything the AI is unsure about. Fourth, those human corrections feed back into the system so it keeps getting more accurate over time. Notice the pattern. AI drafts, a human decides. That review step doesn't go away. It's what keeps the coding accurate and compliant. A few platforms are leading this space, and each takes a slightly different approach. 3MM Modal analyzes clinical documentation in real time, suggests codes, and flags documentation gaps that could support more specific coding. Regard looks at the full patient chart and surfaces diagnoses that are clinically present but never explicitly written down, like malnutrition, acute kidney injury, or sepsis, a problem known as underdocumentation. Enim Health goes further for certain encounter types, coding claims autonomously with no human review when its confidence is high, and routing anything complex to a human coder. Acasa pairs AI with human experts to automate coding, claim submission, and denial management across the revenue cycle. Different tools, same goal: faster, more accurate coding. Charge capture means making sure every billable service actually gets recorded, and it turns out hospitals miss between 1% and 5% of charges, which adds up to real lost revenue. AI tools tackle this by scanning clinical notes for procedures and services that should generate a charge, then comparing that against what was actually billed to spot the gaps. When something looks missing, the system alerts providers or the coding team directly. It can also track patterns over time, so if one department consistently forgets to charge for a specific procedure, that shows up as a trend, not just a one-off mistake. For physicians, that means fewer awkward reminders about billing and more revenue captured without extra paperwork. Denials are one of the costliest problems in healthcare billing, so AI attacks them from both directions. Before a claim ever goes out, AI reviews it for the usual red flags: missing or inconsistent information, gaps in medical necessity documentation, unmet authorization requirements, and code combinations that specific payers tend to reject. Catching those early prevents a meaningful share of denials before they happen. When a denial does happen anyway, AI tools categorize it by reason, payer, and department to spot patterns, prioritize which appeals are worth pursuing based on dollar amount and odds of winning, draft the actual appeal letter with the right clinical justification, and track outcomes to keep improving prevention over time. Prior authorization, getting a payer's approval before providing certain care, is one of the most hated parts of healthcare admin work. A 2024 AMA survey found physicians and their staff spend about 12 hours a week on it, and 94% of physicians say it delays care patients actually need. AI is chipping away at that burden in a few ways. It automatically detects when a service needs authorization and files the request with the right clinical documentation attached. It tailors that documentation to each payer's specific criteria. It tracks the status of pending requests and escalates the ones that are stuck. Some tools even predict how likely an approval is, so practices can plan ahead. Notable Health is one of the platforms leading here, cutting processing time from days down to hours. Here's where this is heading. Routine, high-volume coding will increasingly be handled by AI with a human checking the work, while certified coders shift toward complex cases, quality assurance, and strategic revenue optimization. This doesn't erase coding jobs, it changes what the job actually involves: less repetitive lookup work, more judgment calls. To recap, AI reads documentation and suggests codes, humans still approve them. AI catches missed charges and denial risks before they cost money, and AI is cutting prior authorization from days to hours. Want to see how these tools actually work in practice? Head to this lesson on Free Academy AI and try the interactive prompt playground yourself, or paste a real clinical note into an AI assistant like ChatGPT or Claude and see what it suggests.